My name is Noah Castillo, and I'm doing a normal psychology. Starting off personality disorders. So people with personality disorders tend to not be able to deal with certain situations. Normally, they usually deal with them in more negative ways. This can be with using drugs or not be able to handle their anger properly, or just really downing themselves a lot more than how they should be picking themselves up in certain situations. The three main groups are Group A, B, and C, otherwise known as clusters. So starting with Group A, they lack interest in others and usually have suspicion of others. Group B, they usually have overly emotional thinking and dysfunctional behaviors or like wild behaviors. Um, and then C is they have very anxious patterns. Um, so then the signs and symptoms. The biggest one is that if I were to have a personality disorder, I would not perceive it as having one. Usually I would think I'm normal, and that's the biggest thing about it is that I typically wouldn't get treatment for it because I think I'm normal. And that's probably the biggest giveaway of people not believing that they have a problem. So going on to breaking this down, so paranoid personality disorder. So it's a group A personality disorder to start off with. So lack interest in others, suspicion. So their signs and symptoms is they tend to not really trust others. They doubt others people's word. They never want to really put themselves in certain situations just because they feel like they can't trust others. Um, so they try and like stay away from other people, and they also fear people use information they tell them against them, which is kind of a big thing for them. So treatments is they can go to cognitive behavioral therapy, which basically that therapy is about changing the way you think and view certain situations to make it more positive, so it doesn't bring more harm to you. So that's just a therapy that they can go to. Next is narcissistic personality disorder. So this is the group B personality disorder. Basically, their signs and symptoms is that they tend to view themselves higher than others. They view themselves more valuable. They um, they don't understand how other people like how they feel and what they believe. So they tend to really use that for them. So they kind of take advantage of others. They also fabricate a lot of their stories to make them seem a lot better. So there's just a few things, the signs and symptoms. So treatments, again, cognitive behavioral therapy would work really well just because it would change the way they view others and view themselves. Next is dependent personality disorder. So this is the personality disorder group C. So signs and symptoms is that they really rely on others to make everyday decisions. They feel like they can't make their own decisions, even if it's really small. They fear that if someone leaves, that they'll have to do things on their own, which is like a big fear for them. So they really just the main thing is they rely on other people to do basically everything for them, by just small tasks to big tasks to tell them what to do, what to clean, how they live their life, and they just fear being on their own. So treatments for this, again, cognitive behavioral therapy, it'll help them really view others and view themselves in a more positive way, helping them really believe that they can do things on their own and not have to rely on others as much. Next is substance related disorders. So what it is how people tend to cope with like situations. So if people can usually get addicted to drugs this way, and they usually pick up bad habits and ways they try and cope with certain situations they're put in. So it's usually defined by drugs when going into addiction. So there's opioid disorder, stimulant disorder, and sedative disorder. The cause of this, for a biological standpoint, genes it plays a big thing in uh, hormonal patterns also affect this into why you would maybe start doing drugs. Um, Environmental is a huge one. Who you surround yourself with, what you do day to day. Um, People may influence you. For example, if you're at a party and one of your close friends bring out cocaine and like to like let's try it. Like that could be like just the start of your drug addiction. Also, in a psychological term, traumas. If you go through traumas, people who go through traumas tend to have more chance to become addicted to drugs. So breaking this down to more deeper things, stimulant drugs, what they are. This is typically meth, crack cocaine, cocaine, Adderall. Um, Basically, they make you very hyper. They make you overly confident. You usually have larger pupils as well. They also kind of just make you really energetic and just make you want to do like a lot of things at once. But they are highly, highly addictive for the way they make you feel like you can do anything really just because the confidence you gain. Treatments for this, so one-on-one therapy, family therapy, group therapies, those kind of work the best to kind of put you in situations that make you the most comfortable. So if you want to be with people who are kind of go through the same situation as you are, then group therapies work. If you feel comfortable just being around your family while you talk about it, that also helps. And also just one-on-one if you feel like you don't want anyone knowing about the situation you're going through, that also is available. So there's just some treatments that you can go through. Next is opioid painkillers. So this is your codeine, your fentanyl. Sometimes it can be Percocets, um, Vicodin, Xanax. These are just things that typically you would get after like a major surgery to help you with recovery and help you with pain. That's typically how people tend to get addicted is misuse of them or just taking too much. So signs and symptoms is that they are usually drowsy, again, larger pupils. They tend to um, not be able to like talk very well. Their speech is not as good and other things like that. Treatments for this is that they can go again one-on-one therapies, group therapies, family therapies. Those are usually the main three. Next is club drugs. So this is your ecstasy, your acid, sometimes roofies. So their signs and symptoms is they give people hallucinations, which basically are they see and hear things that other people do not hear or see. Also delusions. They have really strong beliefs about things that aren't true. Um, but they also have smaller pupils. They tend to lose consciousness at times. They have poor memory and other things like that. Treatments for this, again, one-on-one therapies, group therapies, family therapies, those are definitely going to help the most. Next is schizophrenia. So what this is basically um, a very big mental health or mental disorder that causes people to not be able to live their day-to-day lives in a healthy manner because they can't do things really on their own and they struggle a lot with doing things for them and because they're filled up with hallucinations, delusions, bizarre behaviors, and they really can't really do things on their own. They struggle to find motivation, and they also just tend to not be as social as other people and kind of be on their own. So treatments for this, there's no actual like kind of cure to fix to eliminate the whole mental illness, but there are ways to kind of help not have the symptoms as strong with medications, of course. There's also you can try cognitive behavioral therapy, but it's just a really hard mental disorder to really overcome. And these are my references. Thank you.